Good morning, everyone. We're going to be talking today about becoming a better health advocate for yourself. The reason that I decided that this might be some valuable information for us on our own health journeys is because I have been in a situation of trying to help my brother in North Carolina, and most recently working with my husband with this knee replacement that he had day before yesterday. And I began to see aspects of the medical system that I had sort of only watched, but they at that time were not affecting me directly. And I think we kind of just go on about our way without looking deeply into what's happening. Growing up, um, we had one doctor, a family doctor. And usually these doctors did have their own standalone office building, or as years passed, they might be in an office building with other doctors, or they were in a historical home in the town or city. And we went to that doctor. And only did we go to another doctor is if he sent us. So this is basically what evolved from the family doctor into what began to be called the primary care physician. And you would be asked in later years, who is your primary care physician? Then, when the electrical records came into place after 2014, those, whatever you did, if you had to go to the emergency room or whatever, it went to your primary care physician for him to follow up with. Um, Now, the shifts that we have seen now, and I just want to tell you what I ran into with my brother. My sister-in-law died December the 29th, and my brother was entered into a hospital with a respiratory, with flu. When he was later released, he was released to a skilled nursing facility. And I started going up a week a month to try to help my niece, whose brother, the only other sibling, had died a couple of years before during the COVID um, pandemic. So I began to try to wrap my head around his health care. When I got a telemed with his primary care physician that he'd been with for who knows how many years, because they assumed he was going to be on it with me. During the conversation, when I explained why I was talking and everything, I said, I can't get things done. And I'm trying to figure out what is the process. And so in the conversation, he says to me, well, Mrs. Sheppard, I'm not an admitting physician. Now, some of you may know exactly what that means. I did not. I said, what do you mean? He said, well, I cannot admit to the hospital. So I said, doctor, I've never known a doctor who could not admit people to a hospital. Now, maybe it was only one particular hospital or it was selective, but I've never known a doctor that couldn't admit to a hospital. And he said to me, well, that's not the way it's done anymore. He said, um, you'll have to take him to the emergency room. Then they will decide in the emergency room whether or not he's admitted to the hospital. I said, I can't take him through that. I need to bring him to you. And he said to me then, Mrs. Sheppard, I think I agree he needs to be admitted to the hospital, but I don't have hospital privileges. So I said, why not? And he explained that he worked for, I'm not going to say the name, medical system. So I said, so you work for them, and what do you do? And he said, I do the basic annuals, the checkups, the sore throats, and he said, but we do a lot of telemed. So with that, I'm trying to work through the processes. I look into the medical corporation that he had mentioned, and I found out that they had bought out in this certain section of North Carolina, they had bought out all of the hospitals. I think there were three left in this large area that they had not bought out. And then they had they had systematically hired the doctors to work for them. And then, of course, those doctors have a medical protocol that as long as they stay in their box, they're okay. But if they move outside of the box, one, they could lose their job, lose their license, or they they could be liable. So I'm like, holy smoke, this is like a mafia. And I began to call it the medical mafia because I began to realize that we could not work with helping my brother outside of the system. So then I'm looking into skilled nursing for him. And I find out that the one that he had been sent to from the hospital was also owned by this big medical corporation. So then I began looking at the nursing facilities in this pretty large area in North Carolina, found out that all but two or three were owned by this medical corporation. So the procedure, go to the emergency room. The emergency room decides whether or not to put you in the hospital. Go to the hospital. The hospital then, if you are in the hospital and you're released to a nursing facility, of course it's going to be one of theirs. We get it. But then as I began to work through what services, what kind of help, what kind of medical help is he going to receive in the nursing facility? And I may be talking to you all and you may know everything about this. It's again, it's in a box. It's in a box. I recently flew to North Carolina to try to take him to a doctor way out of the system because he was about to lose a foot because in this box he was only allowed to be treated a certain number of times. And you're like, surely, Jackie, you just because you were out of town. No, I don't think so. Because then my husband, um, who had a knee injury in college, had surgery on this knee 1962, who's basically had trouble with it ever since, finally decided that he was going to get a knee replacement. I began working with our system out here in Missouri, and I found out by talking with several doctors that a a hospital organization here has practically done the same thing. They bought everything out, slapped their name on it, which sounds good, but then the doctors have started working for the in essence for what we would call the hospital, but it's actually for a medical conglomerate. And I was asking one of the doctors that I've known for over 20 years, and he said, well, basically, when they began buying everything out, we had to choose whether we were going to work for them in a salaried position or what were we going to do. And he said, I'm too old to fight it. So I'm like, oh my word, what has happened to medical care? And it may be that this is not a problem with you, that you don't see this as a problem. But the reason I felt it was important to talk to you about becoming a better health advocate for yourself. And I'm going to pull up a few facts here because I thought, I wonder if there are any facts on this. So let me show you what I found. Um, let's see if I can show you this. The shrinking number of primary care physicians is reaching a tipping point. Now, I recently took a bad fall, some of you know this, and I had to start seeing doctors. And as I would be referred or called, or they would call me, um, they would be saying, well, he's not taking any new patients, or she's not taking any new patients. Or they would say, his first available appointment is in September. And I'm like, I mean, this was April, and I'm trying to get help. I'm like, so what do I do? And every time they told me to go to the emergency room, which I had already done for x-rays right after the fall. So I'm thinking, this is sounding familiar. So call after call after call and trying to follow up with the doctors that I was needing to see, I realized that I was in a very serious position myself because my physician was retiring and I could not get a new primary care doctor. You'll notice here that it is now, and I don't remember when this was written, this article with, is that it's only about 25% of family doctors now. Uh, Already, more than 100 million Americans don't have usual access to primary care. And if you don't have access to primary care, you may not have access to your specialist because the system is they refer you. 1980, 62% of doctors' visits for adults 65 and older were for primary care. 38 were for specialists. However, now this article is saying there is a specialty driven system. But when I was trying to see the specialist, and I had a good reason to see them, they were completely full until the fall. I did not find one that could see me before September. Um, they're mentioning here, and I think this is the biggest reason, one explanation for the disappearing primary care doctor is financial. Since 2014, the financial reimbursement for doctors has changed. Many of them, the younger doctors, still owed enormous student loans. And when they were forced to have to work for a salary and work in a system where they could give each patient only 8 to 10 minutes, many of them realized, and I've had them to tell me themselves, they couldn't afford to be a doctor anymore. My primary care doctor told me that the reason that they had to move into another area of town is because they could no longer afford their overhead. You'll see that many independent primary care doctors sold their practices. This is happening everywhere to health systems or commercial management chains, some private equity owned, so that today 3/4 of doctors are now employees of those outfits. 3/4 of our doctors, in other words, work for a medical company. They talk about this man here who um, says that he tried to make it work. Um, and he could no longer make it work because he could not afford to literally stay in business as a doctor. So he sold his practice to a company that took over, and you're seeing it scheduling, billing, negotiating with insurers. It agreed to pay him a salary and to provide support staff. Well, most of you know that that support staff is a recording. Outcome: calls to his office were routed to a call center. This one was overseas. And patients with questions or complaining of symptoms were directed to a nearby urgent care center, guess what, owned by the company, which is typically more expensive than an office visit. His office staff was replaced by a skeletal crew that didn't include a nurse or skilled worker to take blood pressure or handle requests for prescription refills. He was booked with patients every 8 to 10 minutes. Is this sounding familiar to you? He discovered that the company was calling some patients and recommending expensive tests, etc., that he didn't believe they needed. He retired in January. I couldn't stand it. And that's basically what my doctor just told me recently. He's working 2 days a week, and this is the reason they cannot do what they feel called to do. Um, so this was interesting to me. Meanwhile, urgent care clinics are popping up like mushrooms. So are primary care chains such as One Medical, now owned by Amazon. Dollar General, Walmart, Target, CVS Health, and Walgreens have opened retail clinics in their stores. You see it all the time. I actually was wondering one day when I was trying to do what I knew I needed to do was because when I finally was able to see my primary care physician, and he was just basically like, I don't know that I can get you a doctor's appointment. So I'm thinking, am I going to end up in urgent care, and what can they do? So the he talks about some things that are possibilities, but this is important. The United States already ranks last among wealthy countries in certain health outcomes. The average lifespan in America is decreasing. Um, and if we address our primary care shortage, if we fail to address it, things may be even worse. Now, so what are we going to do about it? Well, most of us, if we have been working on our own health journeys, we're already not using as many pharmaceuticals. Some of you, like me, I had not been seeing my doctor that regularly other than for blood tests, maybe once a year, sometimes twice a year. We have become more aware of our own health. We've turned to nutraceuticals instead of pharmaceuticals. And we may have failed to realize that you're still going to need a primary care physician. So I want to say to you this morning that you need to find out who owns your hospital. The hospital that's the closest to you, you need to find out who owns them. And then you need to try to figure out, is this, most of us are going to use the closest hospital to us. The other thing you need to find out is who are the doctors now that can use that hospital, because the doctor you've been seeing all these years may not even be allowed to use that hospital. So if you were to have to go to the hospital for some reason, you may not even be able, you're going to have to use who's ever there. There are some excellent emergency room physicians, but typically emergency room is short-term care, isn't it? So find out who owns your hospital. Find out what kind of acute treatment do they have. What do they have for strokes? You see, that little brief time with a stroke is so important. Well, what if the hospital closest to you doesn't have that? Um, Make sure you know what is available to you if you were to need a hospital. Secondly, do you have a primary care physician? And if so, is he able to work for his own practice, or is he working for a medical conglomerate? He will be limited. There will be a box as to what he is supposed to do. I had one doctor since 2014 to tell me I was over 65, of course, and this was several years ago. Uh, I wasn't there as a patient. I was there because they were interested in some of our products, and I was talking to them about the science. And he said, Ms. Sheppard, I am required, anyone that's over 65, I am required to prescribe three medications for them: statins, metformin, and there was one more, blood pressure medicine. I think it was Lipitor or something. He said, I'm required. And I said, well, what if they don't need them? And he said, in in this box, he didn't use the word box, but if you're over 65, you need them. So a lot of times, as you well know, what we're talking to people about are side effects. The body is designed to heal. You got to get the right raw materials in it, and you've got to get the right things that your body needs. Um, so with becoming your own health advocate, find out what medical care is actually available to you when you need it. Find out if your primary care physician is able to practice medicine, or does he or she have their hands tied behind their back. Then work out your own system. You need medical tests every year. You need the complete blood count with what they call differentials. That may be enough for most of you, but for some of you, if you're dealing with underlying symptoms, you may need some further metabolic testing. Now you can order almost anything off the internet and you can look up side effects. This type of information was not available to us decades ago. But you've got to find out if you're taking a prescribed medication, what are the side effects? I was working with a dear friend for years and he had unbelievable headaches. He awakened every morning at 4 a.m. with a devastating headache. And some of you will remember the snorkeling episode I had in Hawaii a few years ago. And when I came back, they put me on a medication. And about the third night, I awakened at 4 a.m. with a devastating headache. And I thought, oh no, could it be it's the same medication? I called him the next morning and asked him. Sure enough, it was the same medication. I said to him, did you tell your doctor you were having horrible headaches, waking up 4 a.m., horrible headaches? And he said, I've been to him again and again and again. He never mentioned it might be my medication, probably because the doctor didn't know. So you're going to have to look up your own side effects. You just put it in there in your Google search or whatever you use, dash side effects. If you're having weird symptoms of anything, look it up. You have that information accessible. Then find out, and you can use these one labs. You can take any test. All of these laboratories around on almost every corner now. You may have to pay for your lab test. But if you do not have a doctor that you have a relationship with, where you can depend on the doctor when you really need them, you are going to have to do exactly, and Carol Roberts and I were talking about this the other day, the Navajo proverb, by the age 40, one must be their own physician. It's not a matter now of carrying a card in your pocketbook with all your medications on it. It is more you becoming your own health advocate. Uh, had uh, there's so many people in this particular nursing home where my brother is. I walk down the halls and I'm watching them, and I truly believe with all my heart our nutraceuticals could have probably prevented them from being there or could help them even now. Now they're on this many medications, and those medications are wheeled out 2 and 3 times a day. And when I began to look in deeper into these, the sedatives, the sleeping pills, the zombie pills they were being given, is the reason that when so often you go into these facilities, they're just over in their wheelchairs like this. Nobody wants to spend the last years of their life this way. You got to start now. And if you have elderly parents or elderly family members, you can't wait. You cannot just say, well, our products would probably help them, but I don't know. They don't want to take them. One of the biggest problems is that many of the medications for the elderly now don't cost anything at the drugstore, or else they're super expensive. The diabetes drugs can be super expensive, but the lesser drugs that they take routinely, um, maybe some heart medications, some blood pressure medications, and so forth, don't cost anything, or they cost just a few bucks. So when you say, I want you to take a product that's going to cost over $60 a month, they're like, can't afford it, not going to do it. So our job is to, one, for those you love, whether it's your spouse, your children, your parents, you got to find a way to talk to them because you want the best for them. Quite often you can use a video, but for many people, they don't have the attention span. This can be young and old to even watch a video. With what we have with our nutraceuticals, we are able to prevent having to have pharmaceuticals that may have some pretty serious side effects. To become a better health advocate for yourself, you need to figure out, where am I now in this medical maze? Uh, what can I do for myself? What can I do for the people that I love to help make this more streamlined and effective if you can need it when you need it. But the best way, the very best way, is by prevention. So, Carol, let's go to questions and answers, and we're going to leave the recording on for a while. Okay? Do we have any questions and answers this morning? Hi, Antoinette. Am I saying that right, Cynthia? Yeah, I think I was close enough. So, yes, how do we have any questions or comments? Lovely people.
Well, definitely a comment.
Go for it, Renee. You have your own story, don't you?
Well, I have it's ever evolving. Went to my primary care. I actually have one, and our system sort of requires it. And but I was fortunate enough to get a DO, doctor of osteopathy, or osteopathic doc, in the system. And we determined a few days ago. I just took her my laundry list of symptoms, and I said, the heart, everything looks fine ish, nothing crazy. And she looked at all my symptoms. She said, Renee, this is endocrine. I said,
Yeah.
okay. She said, I'll get you an appointment with the newest endocrine doctor. This was June 20 something. My appointment is in November.
Yep. Yeah.
November.
Yeah.
I'm like, okay. That's exactly what you were saying.
Yeah.
My brother in law is a surgeon, was a surgeon.
Yeah.
They sold their practice to the hospital. So instead of being South Georgia Surgical Associates, they're South Georgia Medical Center surgical team. Um, they didn't have an exit plan. These doctors don't. That's why they're doing this. It used to be, you were a doctor and your son or grandson or granddaughter followed in your footsteps. The very reason the primary care doctor that my dad sees, the reason that he sees him, or the reason that guy went into practice, I know him personally, went to high school with him. His best friend's dad was the local doctor. And the best friend said, I'm not going into medical. I've lived it my whole life. But that relationship between that young man and his best friend's dad moved him to go into medicine. That's not happening. In fact, my brother, who's the surgeon, said to his three children, medical field, absolutely. Doctor, never.
Wow.
You'll never get out from under the debt today. And you won't be, these doctors are actually telling the next generation not so. He has three kids. One is a golf pro, the other two are in medicine, and they're both nurses, like nurse practitioner, like as high as you can get in the field, but they're not doctors because of the debt that they would have incurred.
Right.
And
And the
that's
medicine. Yeah.
that's what's happening.
Yeah. So that's why we've got to depend on the medical system when we need it. But you cannot afford for your own health to not be aware of what's happening.
They tell us, the doctors kind of ha ha ha. Oh, you've been to Dr. Google. You've self-diagnosed. But the answer to that is, what choice do I have? You've left us, this medical system has left us no choice but to look it up and find our own answers.
Yeah. Now, I during 2012 to 2014, the doctors warned Congress. I remember it well because I was following this closely. They said this is not going to work. It's going to produce a doctor shortage, a physician shortage, and we're living it. We're definitely living it a decade later. Okay, any other comments this morning? And then I want you to work out your own action plan after we get off this morning. I want you to sit down and think, all right, I need an action plan. So, yes, what would you, anything you want to add to us?
Yes.
Yes,
Hi. Hi,
Kathy. Hi, Kathy.
Jackie. Good morning. Yes, so my son is currently in the hospital.
Oh,
Yes, he was admitted, and I'm curious whether high fructose corn syrup had exacerbated his symptoms because we had been in Airbnbs. We were traveling, and he was fine. His symptoms were manageable. I mean, he's not quite fine, but he's manageable until this other Airbnb, the neighbor gave him, he had a party and had a whole pitcher of fruit punch. And Christopher, went there, and I asked, and he said, "Oh, take the whole bucket." And I asked a neighbor, I said, "What's in the fruit punch?" And he said, "Well, a bunch of juices, and I added 7 Up. And I said, "Oh boy, that's the high fructose corn syrup." And I noticed that my son's symptoms, a lot of it has to do with blood sugar. When he's hungry, he literally, the symptoms come, like the OCD intrusive thoughts would come. And then so I thought, maybe the sugar, maybe he could, maybe it would help him. And it did calm him for a tiny bit. And then he drank more and more and more of it that evening. And then I didn't realize, but he went to a neighbor and asked whether the neighbor had guns, and said something about wanting to either kill himself or kill other people. And so then, the next day, our Airbnb, the owner came and said, you cannot stay here. The police came and said, you guys got to leave. And then ended up, my son, was admitted in the hospital later on last night. But I Googled and searched, okay, does this medication, he's currently on clozapine and Depakote, do they raise high blood sugar? And it says yes, it could cause hyperglycemia, is it? Or, yeah, so high blood sugar. And then I asked a question, could high fructose corn syrup cause depression? Because he kept saying he felt depressed. He didn't say that before. And then he kept saying he felt depressed. And then also, could it cause psychosis? And it says yes, because of brain inflammation. And that's the whole gut brain inflammation. And now we're in Massachusetts, and we're looking into, I guess, from the ER, because he's in the ER, and look, they have to put him in a placement into a hospital bed. And my husband and other people are suggesting McLean, and if McLean, in Boston, has a bed, then he would go there. But then I, really don't want him in the medical system, because I just feel like all they do is medication. That's their only tool that they have. But at the same time, right now, he has to be stabilized. He's not safe to himself or other people. But the meds did all that to him, in my opinion,
Right.
because yeah, because that's what it did. Is it completely messed up his metabolism, completely messed up his nervous system, and he used to exercise and have a 6 pack, and now he's gained 80 pounds, and he couldn't exercise. He doesn't have energy. And last night when I visited him at the ER, he was calm. He was given Ativan. And he said, "I wonder, Mom, like, because I said to him, I said, if you had agreed to do the IV therapy or like some, other therapy, we might have been able to help you faster." And he was more clear minded. He said, "I wonder, Mom, maybe I should have done the Dr. Amen clinic, done the brain scan. Maybe I could do the IV therapy." But so he had a little bit more of a sound mind, where he at least had some insight. Um, but interestingly, my sister-in-law, because all my husband's family's here, and she's a nurse and she knows the medical system, and uh, my sister-in-law suggested that we utilize the Massachusetts healthcare system, because they do have a lot of resources for people with mental health issues. And I guess, I mean, my son does need psychotherapy. He does need that type of service. And they have something called respite service, where if the parents needed help for the weekend, just for at least some time away from Christopher, that we could get that kind of service. So in that sense, it's good. But I just know that I have to really advocate for nutrition and advocate for him to take supplements, like yours, Jackie. Um, and, just be able to advocate for him. Because right now, the route is to be his temporary guardian. And so that we can at least have a say with the doctors and I just feel like it's a trap. It's a system, it's a trap because that's all they have, all the tools that they have, and unless you bring in the lifestyle and the nutrition and the psychotherapy is necessary, but it's um, only effective if he has a sound mind, if he has at least a stable mind enough to be able to, think through these things. And as far as primary care doctor, I run into the same thing. I went to someone who's quote unquote holistic, and she was like basically 15-minute med check. Like, I don't take any meds, but it's sort of like, for my son, I took him to the same doctor, and she's like, oh, he needs like a specialist for this and that, and like she didn't have time. It was like the $50 copay, and you're in and out of there. It's really, I don't even have my own, like I didn't sign up for the insurance, except for like kind of like only for emergency type insurance right now, because I do everything out of pocket. Is really senseless, But for my son, because of emergency rooms, we do still have him on more expensive insurance care.
Do you have the Life Vantage insurance, Kathy?
No, I don't
Well,
know about that. I don't know that
I want
life.
to look into it. Life Vantage offers a Medishare style
Oh, I
healthcare
should.
option. Now Carol's on it.
Oh,
I'm on mine with my husband because he gets his through the university. But if it's a struggle or you can't get it, look up. Carol, would you just jot her if you could? I'm not want to put you on the spot if you don't have it, but if you do,
Yeah, I can find it.
yeah, it's called Life Vantage Health
Clearwater.
through a company called Clearwater.
okay.
And
Yeah, because I pay something out of pocket from, I can't even remember
yeah,
myself. I just signed up this
this
year.
this this is a share system,
Yeah.
but it may be an option for you.
Yeah, I
Yeah,
would
I'm
look into it.
trying to remember. I think it's down at the end of like the bottom of our page.
I'll look into it.
She just gave you her number to text her.
Okay. Yeah.
Kathy has been on this medical hamster wheel for so long with Christopher. And I first met him when I think I've told you before, I thought he should be a model. Super bright, super sweet, great heart. He just college kid wanted to experiment with stuff he had no business experimenting with. And one thing leads to another till you get to psychosis. It would take 28 days. Those of you who've read my book, it takes 28 days off of all medications for the body to go back to what we call basal, where the neurotransmitters, the everything would be what they naturally would be. The problem is there's so few places that can truly manage this type of withdrawals for a full month. And so therefore sometimes if they're going to try to get them off of all of these heavy duty mind altering medications, they have to span it where they're getting them off of one. Maybe in that, who knows how long that's going to take till all of those withdrawal symptoms are gone. Then they can start on another. So getting people who are over 18 to admit themselves to a long-term care residential facility and finding them that are not weird and depend and continue to use medications is has been a nightmare for Kathy. She's looked high and low. I know she has. He's been in I don't know how many different rehab places, but the thing that we can all pray with her is that Christopher hopefully, even with this conversation with his mother, maybe he's coming to a place where he realizes that he's got to have a deep, deep desire for a deep spiritual change, as well as he's got to agree and not fight against his mother with what he needs to have done. He is a wonderful young man. He is, isn't he, Kathy? But
Yes, yes.
he doesn't, it's hard to even know who he is because he's been on what the Bible calls sorceries. The pharmaceuticals in the Bible are called, it's the same word for sorcery, because we know that these medications can change your brain. And even right now, big article yesterday, I have been on a soapbox since the 60s saying that marijuana changes and ruins the brain. And they were like, oh, no, no, no. Yesterday, a group of scientists came out with a big study saying it absolutely is harmful and it does indeed change the brain. So here we are in a broken medical system. We are out of time. Kathy, you want to make one more comment before we hop off? You got your hand up, or was that you've already?
Oh, I just thank you so much. Lots of prayers needed, as my husband and sister-in-law and most people out here believe medication is the answer. Um, Whereas I pray for no meds at all and deliverance, obviously, from our Lord, and miracles and healing completely from Him, and deliver Christopher, spiritually.
Yes. And that's exactly where it's got to start. And so we want to, and Christopher does have a deep interest in God. He really does. He's just real confused. So remember, we are family. We are LifeVantage family, and we'll do our best, Kathy. And I'm seeing Jacqueline Laporte. Welcome, Jacqueline. Is this your first time with us?
Yes, Cynthia had invited me to pop on. I was on a call with my sister at the time. She's having some problems. But anyways, I just signed up to start getting Protandim and I think collagen, she said. I'm going to try it.
Wow.
She does recommend, she is trying to, have me pursue like being a consultant. I do have a medical background. I'm a nurse, and it's funny. Some of the people I work with or whatever, I'm on saying, well, I've been listening to information on Protandim. Have you all heard of this? This is what it can do. And so I already have people saying, where do you get it? And one girl at work, um, I was working in recovery, and she didn't have a patient. She goes, I'm going to look that up now. And of course, our day got busy, and so and so and so forth. But to make that step is hard for me at this point.
Yeah.
But I told her I wanted to try, and just a lot of prayer to try to see what my life will.
I
I
have
don't know
a,
how to do it. It's
I think you should.
yeah. So, but anyways, yeah. So she had said to get on, and my sister had to hang up and call her daughters. So I said, well, oh my goodness, let me see if they're still on. So, but yeah. So heard a lot about everybody. Of course, you too, Jackie. I've heard a lot about. I think I actually saw one of the videos you were on. So, but yeah, it's nice to meet you all. This community, it's very nice. And I will continue. I will pray for Christopher. I will. I will.
Something Cynthia may not even know is
Yeah.
that Jackie via Zoom has actually done a presentation in the library there in Tom. Are you in Thomasville with Cynthia?
No, I'm actually in Louisiana.
Oh, okay.
So something got researched here that LifeVantage did. I don't remember what
Absolutely
it was.
right.
So I don't know.
LSU
So
did.
it's like I want to know more of that. I want to. So it's like I'm trying to. We all have busy lifestyles and stuff, but there's so much has been changing in my life. But I'm trying to get that information. I was telling her the other night, Cynthia, I want to buy that notebook where I would tab it when it has something to do, so I can go right to it. So it's like I'm starting to get. I'm very interested in it, and me too. I'm on that health, you know, like Kathy was saying, just to have, that God has it. He knows our cells. He knows how we're made. He knows what's out there. He knows people are doing the right thing, but it is the mindset, and God can heal. We've seen it. We know miracles. We've seen it. I have a homeless ministry in New Orleans, and I've seen it, and it's just amazing. So, but yeah, I will pray for Christopher. Keep him in my prayers.
Well, we're so glad you're on, Antoinette. We welcome you. That was a study on original skincare. But I want to encourage you, Jacqueline, to take a before and after. Go ahead, take a selfie before you start that NRF2 and that collagen, and then watch what happens. And then when people, whenever you're around and they're like, "You look great," you just say, "I'll send you some information." Love you all. I got to dash to the hospital and
One more,
um,
one more thing, if I could,
my
because
husband. Yes, Renee. Yes.
speaking of our collagen and speaking of before and afters, guys, Miss Jackie has asked me to put a book together
Yes.
for
Yeah,
collagen.
you won.
Um,
You won. You did a beautiful job on the collagen already.
I mean, not the collagen. What am I trying to say? The MB. I mean the mind body system. Let me get
Right.
this. Take two. Hey guys, Miss Jackie has asked me to put a piece together like we did for collagen for the mind body system. I need all y'all's. That's y'all and all y'all, right? I need all y'all's pictures, and even if they're like all of them, like not just yours, but all that you have. And if I have duplicates, that's fine. But I'm going to go through them and do a book just like we did for collagen, and we're going to do it for the mind body system. Send them on and tell everybody to send them to me. And if you, the best way is Renee W. Parker at Gmail.
So
Okay.
before we jump off, can you guys text me and I have your number? Because Jacqueline, my son has a big heart for homeless. Like he kept saying, well, he kept saying he wants to be homeless, which is his not his sound mind. But at the same time, he's seen how when he was homeless, how people had helped him. So anyways, it's I would love to connect. And then Renee, with the pictures. I don't have any pictures right now, but I would love to see them. I would love to see the
I
book.
I just sent you a text too, Kathy, with some information, but I'm looking for a more direct link for you too.
Thank you. I appreciate it.
Yeah,
Okay, did
absolutely.
all of you get Kathy's phone number if you feel led to be in touch? I don't see it right now. Let's see if I can find it here. Kathy, what was that number again?
847-828-0322.
And I've got it if any of you want to get in touch with me, if you feel like, yeah, I need to be in touch with Kathy. Love you all and see you next Wednesday. Bye.
Thank you.